Hi, this is Dr. Paul and welcome to another session of Ask Your Pediatrician. Today I'm going to talk about what to expect the first week of life. This is going to include what to expect when you go to the hospital, and the two major topics in the first week of life are going to be feeding your newborn baby and jaundice. So we'll touch on those two topics. When you go to the hospital, you're going to sign in to have your baby and you're going to sign permission for all routine care. I like to advise my patients to think about the fact that in most hospitals in the world, and certainly here in the United States, you will be given the hepatitis B vaccine, a vitamin K shot, and erythromycin eye ointment. With regards to hepatitis B, I just like my patients to be aware that that particular vaccine has 250 micrograms of aluminum. The adult daily max for aluminum is 50 micrograms, and we know that aluminum is a neurotoxin. It's still worth giving this vaccine if you, the mother, have hepatitis B, or if your status is unknown and there might be a risk to the baby, then you should definitely do this. However, if mom's hepatitis B status is known and she has immunity or has had the vaccine series, is protected, or we know she's hepatitis B negative, in my opinion, and this is just one opinion, that vaccine can be done a little bit later when the child's a little bit older. Be aware, as I said, when you sign in to have your baby's care and you're giving permission for routine care, you probably are giving permission for the hepatitis B vaccine, the vitamin K, and the eye ointment, as I'd mentioned. Now, to talk about the two main things that are going to come up this first week. One is feeding. Now, most moms in this country, and in fact across the world, I highly recommend breastfeeding. The Academy of Pediatrics has made a very strong statement of just a lot of benefits to breastfeeding. It's not just nutritionally superior. I would ask anybody that wonders about this, take a look at a can of formula, read through the ingredients. You will see a host of ingredients with strange names, including partially hydrogenated vegetable oils. That sort of reminds me of fast food, partially hydrogenated. But just to cut to the chase, basically breast milk provides benefits in your immune system. Many documented studies showing a lot less infections, upper respiratory infections, ear infections, pneumonia, sepsis, it goes on the list, and also many studies showing improved brain function with breastfeeding as opposed to formula. So if at all possible, you want to breastfeed your baby for the whole first year if you can. Now, when you're in the first week and if you're having struggles with breastfeeding, moms, please don't stress about this. It is not easy getting that going in the beginning. We have lactation specialists who can help you, in particular if you're having struggle with latch. The supply issue sometimes comes into play. 95% of moms are going to breastfeed just fine once you get through this initial struggle. So get the help you need, take advice. You'll get a lot of different pointers. Use what works, and I'm sure you'll be successful. And it's going to be a wonderful experience once you get through the initial hard phase. So feeding is that first challenge, that first hurdle, and what we try to avoid is more than a 10% weight loss. And also your typical feeding pattern, I'd say for most people, is both sides every 2 to 3 hours. Maybe at night, once it's going well, it's going to be every 3 to 4 hours until breastfeeding is well established, you've got good weight gain. Then you can just go on demand or on schedule, however you desire. So that's just a little tip on breastfeeding. The occasional child who really struggles, either because the milk is slow to come in or they just don't have a good latch, can't get good letdown, can't get a good amount of breast milk from breastfeeding, and loses, let's say, 10% or more weight, those babies are getting lethargic, listless, they're not sucking well anymore, and it's a vicious cycle. In those rare cases, sometimes we do recommend supplementation with formula or donor milk so that you can get that baby to become vigorous, start to thrive, and then they do their job well. The other topic I wanted to address, the other main thing you're going to look for in this first week of life is jaundice. Jaundice is a yellow color to the skin. We typically say a little bit of jaundice on the face and chest is okay, but really what you need to know is all babies get jaundice. It's a matter of how jaundice they get. A newborn right at birth typically has no jaundice. It peaks by about day 4 or 5. So in the hospital, many hospitals are checking something called bilirubin. This is a measurement for jaundice, and it's routine in a lot of hospitals. What we are watching for is that the bilirubin does not get so high that it could potentially cause problems for your child. As bilirubins get very high, and this is often associated with dehydration and lack of adequate breast milk or feeding problems that are resulting in inadequate intake. Then you've got that vicious cycle of bilirubin that makes babies a little sleepy, dehydration that makes them sleepy, and they're just not doing well. So if you see yellow down to the legs by day 3 or 4 or 5, and you're at home, you're going to want to take your baby in and have them checked, have your pediatrician or your provider kind of go over the situation, look at the weight loss, and see whether or not they need to send in a bilirubin to check for jaundice. If you're in the hospital, most hospitals will check for this, and the solution for jaundice is basically twofold. In most cases, just more volume will take care of it, period. In very severe cases of jaundice, we'll do something called phototherapy, which is light therapy. As light hits the skin, it helps break down the bilirubin. And if you have other questions you'd like addressed, just leave those in the comments, and I'll be happy to address those in future videos. Well, I hope that's been helpful, and this has been another session of Ask Your Pediatrician. And remember, I'm your pediatrician.